A lot of our MF patients do tend to be elderly, and I think while the approved treatments are all JAK inhibitors, we have 4 of them, and they have somewhat unique side effect profiles, and I think one needs to consider those. And then with the elderly, many times you're not thinking of a stem cell transplant. You may be looking to manage their treatment just with pharmacologic therapy without thinking of it as a bridge to transplant, which may apply to a younger patient population. So I think there are a few things to keep in mind. For example, ruxolitinib has a significant risk of triggering shingles. And so in my practice, for example, everybody who gets ruxolitinib gets the Shingrix vaccine. Now that is, of course, indicated for all adults 50 and older, but not everyone's had it, and that is something I definitely make sure to recommend. Skin cancers, people who've had skin cancers in the past are more likely to develop them on ruxolitinib. So that is another thing to counsel about, maybe have close dermatologic surveillance if that's the case. Now, as you think about some of the other drugs, let's take the example of momelotinib. That can cause a first dose hypotension phenomenon. So you want to counsel them to take it at bedtime. You don't want to fall and stuff like that because they didn't know that they could get hypotensive and dizzy. So that is something to counsel them about. Take it at bedtime in the beginning at least. So things like that. And then, pacritinib, fedratinib can cause significant nausea and diarrhea. So you want them to have their antiemetics and antidiarrheals on hand, be proactive about taking them, sort of counsel them that this is to be expected. Pacritinib, for example, 48% of patients get diarrhea. That's a high percentage. Fedratinib can give you considerable nausea and diarrhea. And then, there are other things. Pacritinib has a bit of a bleeding risk. So you want to be careful about that in the elderly, especially if they have a background of, some sort of hemorrhagic event. And then finally with fedratinib, there's actually a black box warning about wernicke's encephalopathy. Obviously, this applies to everybody of all ages, but especially in the elderly, you want to make sure that they are taking their thiamine supplement. You want to make sure that they're not malnourished and check their thiamine levels over time. So there's quite a few nuances, I think, that creep in, as our therapeutic choices expand, especially in the elderly patients. And then also, often in the elderly, you're having to, frankly, with any age group, you may have to support their anemia with other drugs. Beyond the JAK inhibitor. So you could be giving them danazol or an ESA or luspatercept. And then there are some, while those are broadly safe, there are certain toxicity considerations there to be aware of as well. Like danazol can increase prostate cancer risk. It can mess with LFTs. So there are lots of little caveats to keep in mind.